Hello, everyone, and welcome to the sixth edition of Encora Talks. Today, our topic is the challenges and solutions related to IoT adoption in healthcare. Our speaker is Pamela Joes. She has over 18 years of experience designing and developing applications in various domains such as real estate, cloud computing, logistics, finance, gaming, and more. As a technical architect at Encora, she must understand her customers' needs, analyze their requirements, and design the optimal solution. Please let us know your questions through the chat. We will be answering them in our Q&A section after the presentation. Hello, Pamela. We're so happy to have you here, and thank you so much for being with us today.
Thank you, Daniela, and I'm so excited to be a part of this platform. Thanks a lot for the opportunity. So today we are going to discuss the challenges and solutions related to IoT adoption in healthcare. So this is our agenda. Though remote censored medical devices have been around for more than a decade, and the concept of telemedicine is in practice for a while, the underlying technology has evolved 100x times throughout the recent years. Here, we provide an overview of the challenges and solutions to IoT adoption in healthcare, sometimes called Internet of Medical Things, or IoMT, ranging from supporting the achievement of fitness goals to maintaining healthy habits and managing life-critical scenarios. We are focusing on the issues that must be tackled to stabilize the IoT-based healthcare environment, IoT-based smart devices and systems, and a variety of IoT applications in the healthcare industry. As you all know, the Internet of Things, or IoT, is a network of wirelessly linked interconnected digital devices that can capture, transmit, and store data without involving human or machine intervention. Let's look what is digital health. Digital health, or e-health, refers to the use of IoT in the health sector to improve patient care. It refers to a way to monitor the parameters of our body, and the concept of emergence of digital health, or e-health, is to specify the use of IoT in health sector. This includes innovations in countless areas such as doctor-patient communication, research, and hospital management. Here we have a few statistics. IoMT market is expected to develop at 25.6% CAGR by 2025. And 135.87 billion US dollars is the projected size of IoT in healthcare market by 2025. Now, I guess you can understand the massiveness of what we are talking about here. Let's go through some use cases, which are health monitoring devices, e-wellness, examples of IoT or MOT other than the health monitoring devices, assisted living, etc. So we'll go through each use case in detail. Here we have some examples of health monitoring devices. Glucose monitoring. These devices provide continuous automatic monitoring of glucose levels in a patient, and they can alert patients when the glucose levels become problematic. It can either go down or go up. So whenever it's above or below the required level, it will alert the patient. Heart rate monitoring. These are very small IoT devices which are available to monitor the heart rate of the patients while the patients can move around freely, assuring that their hearts are being monitored continuously. Hand hygiene reminders, which are the need of the hour, I guess. Many hospitals and other healthcare operations use IoT devices to remind people to sanitize their hands before they enter the hospital rooms. You have depression and mood monitoring. By collecting and analyzing the data of the patients like heart rate and BP, mood-aware IoT devices can infer information about a patient's mental state. Parkinson's disease monitoring. IoT sensors continuously collect data about Parkinson's symptoms. These devices give patients the freedom to go about their lives in their own house other than being hospitalized for observation. These are some other examples of IoT or IoMT. The wearable devices, what we have seen earlier, they are the most commonly used type of IoT devices. But beyond monitoring, this goes to actually providing the treatment or living in or on the patient. These are the kind of IoT devices we are talking about. Connected inhalers. These IoT connected inhalers can help patients by monitoring the frequency of asthma attacks, as well as collecting the data from the environment to help healthcare providers understand what has triggered the attack. Ingestible sensors. With ingestible sensors, it's possible to collect information from digestive and other systems in much less invasive way. They provide insights into stomach pH levels, for instance, or help pinpoint the source of an internal bleeding. Connected contact lenses. These smart contact lenses provide an opportunity for collecting healthcare data in a passive, non-intrusive way. Robotic surgeries. By deploying small internet-connected robots inside the human body, they help surgeons perform complex procedures that would be difficult to manage using human hands. And this can reduce the size of incisions, which will result in less invasive process and faster healing time for the patients. E-wellness. E-wellness provide people with the opportunity to improve and maintain a healthy lifestyle, depending on their genes, habits, and goals. IoT provides up-to-the-minute info in real time about the health and lifestyle of users undertaking physical activities. Fully personalized training regimes and activity cycles are available. It has been designed for them, and integration of AI and predictive analysis into the fitness apps and diet planners or health trackers. They make these devices more intelligent and personalized. Assisted living. This term is about using IoT to help people with disabilities or elderly who cannot live independently by creating an environment that can support and monitor them with intelligent agents. There are three main domains as part of assisted living, which are activity recognition, vital monitoring, and surrounding environment recognition. With the help of this assisted living solutions, seniors or disabled, they can continue living at home independently, as these devices give them the security of being monitored and enable them to quickly call for help in case of any emergency. We are moving into the challenges and solutions of IoT adoption in healthcare. Today, we are primarily looking at the top 6 challenges, which are security and privacy, connectivity and cross-platform compatibility, cost of the IoT healthcare solutions, poor device management, data collection and processing issues, and lack of skill set. Let's look into detail what each issue is, or the challenges and the solutions which will help us tackle each challenge. Let's look into the first challenge, security and privacy. Security and privacy are the most controversial and significant challenges of IoT adoption. The security here is not only the network security, but the security of all the components involved in the IoT applications. These applications are backed by a network that connects the hardware and software components and involves a huge amount of data traveling through a number of connected devices. With such humongous data online, it's vulnerable to cyber attacks and hacking. It further alarms a threat to the entire health ecosystem, as the health record can be misused to create fake IDs or to make a fraud claim or even dispense unauthorized medicines. So let's look into the security and privacy issues in detail. The data exchange security, that's the security of the huge amount of data transferred from IoT sensors and devices to the platform and then to the storage, is a challenge. Physical or device security. The IoT devices are usually unattended, and hence it can be easily tampered by the hackers. Thus, checking whether the security component is added to an IoT device is a challenge. Firmware or software can also be one of the greatest sources that affect security. Then comes the cloud storage security. Though cloud storage is considered secure, it's a challenge for developers to ensure that the IoT platform is properly encrypted, which is capable of protecting data and appropriate access and authorization is taken care of. Privacy. Ensuring the privacy of data fetched by the IoT devices is another challenge. Let's look into the solutions of these issues in detail. Data encryption. Ensure that data encryption protocols are followed during app development. By encrypting the sensitive data, we can prevent unofficial access or data thefts. Furthermore, this can help us to safeguard the confidentiality and privacy of our data. We need to assure that all the main pillars of security, that's integrity, availability, and confidentiality, are accomplished. Implementing all security alternatives like authentication and device management solutions can stop unauthorized data, software, and services access. We need to use expert knowledge to implement all these security solutions. We can use device authentication to prevent unauthorized access to a connected device, and also to make sure that the data it generates is accessible only to authorized people. We need to implement strict standards, best practices, and guidelines available from authentic sources. Comprehensive testing. Each device needs proper testing before being launched into the public, and updates need to be released regularly. We can use the brute force attack prevention techniques to ensure that the data is secure. We should not use factory default credentials. Also, it's advisable to make the route user inaccessible by using different SSH security features. We need to avoid using weak passwords. Instead, we can use a strong password or a CAPTCHA to avoid sensitive privacy issues. We can make sure that the information stored on the cloud through the IoT device is compliant to specified regulations like HIPAA. Complying to regulations will help us to ensure the privacy of data. Cached data and data which is no longer needed should be disposed of securely. To avoid the security threat of untrustworthy communication, the best way is to use the transport encryption and security standards like TLS. Another way to use different networks that isolates different devices. Also, whenever possible, we can use the private communication so that the data transmitted is secure and confidential. Let's move into the next challenge, which is the connectivity and cross-platform compatibility challenge. The essence of Internet of Things or IoT application development is the real-time transmission of data. But this becomes a challenge because of poor connectivity or latency. While website crashes are a common thing, crashes of IoT healthcare devices are inadmissible. We know that a life is at stake here. They are involved in vital processes of patient treatment such as health monitoring or medicine dispense tracking as well. When integrating multiple devices, despite the connection between various of them, the difference in their communication protocols make data aggregation much more difficult, leading to slow down internal processes. Another issue which affects the network is the noise. It can affect the quality of the data. Let's see the solutions. Although most IoT devices within a healthcare facility will be connected via Wi-Fi, it needs to have the cellular capabilities to provide a failover connection in case the Wi-Fi network goes down or otherwise inaccessible. In field settings where Wi-Fi might not be available, the ability to properly connect to a cellular network is of primary importance. Thus, finding the best cellular network for a given device in a given setting is important. QA specialists should make sure that switching the device to offline mode will not become a threat to life, and data transmissions will not be violated during the technical failures. So we need to be sure about the offline mode functionality of the devices. Performance engineers need to select testing tools for a specific protocol combinations and make sure that all the functionalities of the integrated devices are tested. Better architecture helps to transmit the data without affecting its nature. We can use the noise removal techniques, which can help to enhance the data signal. We are moving on to the next challenge, which is the cost of the IoT healthcare solutions. Initial implementation cost is going to be at a higher end due to infrastructure investment for healthcare providers and business partners. The cost of installing all the devices and their maintenance costs is also quite high. It is not a solution, but The good side of it is the costs are completely worth if the IoT implementation is the one that solves a genuine problem. Also, IoT may reduce the cost for diagnosis and treatment for patients, which is a good thing. While we spend a significant amount of money and resources in developing an IoT application, the returns will be equally huge when the business saves time and manpower. Through IoT, we can improve the business processes, generate more revenue streams, and create more business opportunities, which is the good side of it. Poor IoT device management is another issue. Connected device management is crucial for accessing and maintaining devices that perform tasks and data reporting in mission-critical applications. These devices must be monitored for security and uptime and updated with patches and enhancements. The combination of traditional connected devices and legacy systems, such as ventilators, patient monitors, etc., with poor security features are prone to hacking attacks that include disruption of operations, compromised customer and data safety, etc. So what can we do to avoid these? Remotely controlling IoT devices. When you control IoT devices remotely, you can send data and request to communicate and check functionality. Sending over-the-air update. A good device management solution must include a robust OTA or over-the-air update solution as a core component. Monitoring device health and activity. Real-time status reporting and health check of the devices are crucial. The IoT security threats of the devices can be radically reduced by implementing IoT security solutions, which comes as a part of the device management. The next challenge is data collection and processing. IoT applications involve a huge amount of data. Collection and processing the same is a challenge. Along with the privacy and security planning, development teams need to ensure that they plan well for the way data is collected, stored, and processed within an environment. Cloud storage can be a solution, and it should comply with the platform requirements. We need to employ data experts, analytic engineers, and machine learning resources to get insights from the data which are stored in the cloud. AI tools and automation can be used to make it easier to sift through massive amount of data. The final challenge which we are looking at is the lack of skill set. Lack of proper skilled resources for IoT application development is a challenge. The development challenges of IoT health applications can only be handled if there are proper skilled resources working on it. The right talent will always get you past the major challenges and will be an important asset. Training and skill upgradation programs need to be in place. Insightful workshops, hands-on newsletters, and bulletins can make a tremendous difference. While these are some of the major challenges that appear while adopting IoT, it is imperative for development companies to adapt and adopt technological advancements to drive IoT developments. Having said this, it is essential for a developer to be aware of the challenges and get ready to work for them. IoT is going to be an integral part of the patient's diagnosis, treatment, and recovery process. Being prepared to harness this digital power would prove to be the differentiator in the increasingly connected world. With that, we conclude the talk of the day. Thank you.
Thank you so much, Pamela, for all this valuable information. Now we're ready to start with our Q&A. Please remember that there are going to be some questions that we will be answering through the chat. So let's start with the first question. Will consumer wearable devices be able to provide more advanced analysis on users' health?
Yes, they will evolve and bring more actionable information. For example, Apple Watch, it now includes an algorithm that diagnoses atrial fibrillation. There is potential for more advanced diagnosis like this, especially now that AI can be used, which analyzes the patterns and anomalies in measurements from these devices. So yes, it is going to provide more advanced analysis.
Okay, thank you, Pamela. One of the challenges in healthcare is to ensure adherence to medication. Is this an area where IoT can help?
Yes, there are already startups in that area. For example, companies that provide connected pill dispensers and platforms with initial good results in increasing the medication adherence rate. So yes, there are changes going in that area as well.
The next question is, in general, are most people comfortable in sharing their health data through IoT?
That's a good question. The recent survey shows that most people are willing to share their data if that helps with their treatment and recovery. But of course, people continue to be open. For the people to be continued to open, we need to make sure that we handle the such data carefully and with security and privacy, with all the aspects that we have discussed before. So if a data leak scandal or any hack occurs, then people will start to move away from it. So we need to make sure of the security and privacy so that more people will be ready to bring it up.
Okay, Pamela, I think that will be all for today. Thank you so much for being with us. And thank you so much to all of you for being with us today as well. I invite you to go to our YouTube channel and see the other Encora Talks webinars we have had. Thank you, and we'll see you soon. Bye.
Thank you. Bye.